Good evening, ladies and gentlemen. I'm here to talk today under the title, The Obesity Pandemic, Can We Stomach a Solution? I'll come back to this later. So, what is the current position and what is the issue? The world is experiencing a global epidemic or pandemic of obesity and overweight individuals. The World Health Organization currently estimates that 40% of the adult population of the world are overweight, and of this figure, 13% are obese. This figure has doubled in the last 30 years alone. And it's not just a cause for concern for developed nations like our own, it's also one that's starting to exhibit itself in developing nations around the world, a truly global issue. So, no man is an island, and the Isle of Man does not escape this issue. In 2009, the Isle of Man Health and Lifestyle Study showed that 50% of the adult population of the Isle of Man were either overweight or obese. These figures resembled strongly those of the UK, and recent statistics in the UK suggest this figure is now over 60% overweight or obese. Obviously a great concern. And in 2013, figures for reception-age school children in the Isle of Man, the first year of primary age school children, suggested 20% were overweight or obese. So something that's manifesting itself in our younger generation as well. This drew Alan Bell, Chief Minister, to identify in 2013 that parents should take responsibility for their children and their diets, and for their own diets, in pursuit of righting this issue. And why is it bad? Why can't we be fat or obese if we choose? I would assert that the issue is not about obesity and overweight. In fact, that's just a manifestation, a visual manifestation of a greater issue. This is illustrated well by a statistic from the United States, which shows that 40% of normal weight adults, like myself and like many of you in the audience today, are actually exhibiting obesity internally through fat deposits around organs in ectopic fat. And this is the great concern, because the overriding concern is chronic disease, not obesity, which is a visual manifestation of it. So what is chronic disease? Well, in 2011, starkly, the United Nations identified that for the first time ever, chronic disease had accounted for more deaths in the world's population than communicable diseases such as HIV and AIDS and malaria. The diseases encapsulated by the term chronic disease are things like heart disease, which accounts for 1 in 5 deaths in the UK population currently, type 2 diabetes, which accounts for nearly 10% in the population of the adults, and things like liver disease, atherosclerosis, hypertension, gout, strokes, certain forms of cancer, and steatohepatitis hepatitis. So, what is the cost for society because of this? Well, currently estimates for the UK suggest that there's a £14 billion direct cost to the NHS for treating these conditions, these chronic diseases, and an estimation of a £27 billion cost to wider society through lost economy, sick days taken, lost utility, lost capacity to the economy. If we make a crude estimate from these figures to extrapolate to the Isle of Man situation, that would suggest a figure of around 18 million per annum to address the direct cost to the NHS for addressing these conditions, and also a 35 million cost to the wider society in the Isle of Man through the lost economy and sick days taken. This is obviously a grave concern. So, we've identified the problem, the chronic disease, the obesity, and we've identified the issue to society, the massive costs that we're exhibiting, and the massive burden it's placing on us, and not only us, developed nations, but also developing nations which don't have the infrastructure or the health services to cope with this issue. This was a statement made in 2008 and represents the idea that it's individual responsibility. Individuals are choosing what they're consuming, and it's their fault, and they should take the burden for it and change their habits. But I think that that's looking through the lens the wrong way. What we should be looking at is the environment, and specifically the last 40 years, and then looking back at the individual who's going to be subject to this environment. And what is it in our environment that's causing this problem? This graph illustrates the increased consumption of sugar in our environment over the last 30 years, but over the last 300 years, but notably in the last 40 years, and against the increase in obesity. So, what is it about sugar that's causing the problem? Sugar is made up of glucose and fructose, and I would assert that it's the fructose within the sugar in our diets that's causing this real problem. Fructose is implicated on all these chronic diseases. When you consume a can of soda, what you actually consume is fat, because fructose is metabolized at the liver as fat. Then it has an issue with liver disease, cirrhosis, inflammation in the liver when fructose is metabolized. Next, it has an issue of insulin resistance, creating insulin resistance around the liver, which causes the pancreas to boost up insulin all over the body, creating an insulinic state, which has an implication for type 2 diabetes. Then you have atherosclerosis, build-up of fat deposits around the interior wall of the arteries, so heart disease. Then you have uric acid, which is released when fructose is metabolized, and that's implicated for hypertension and gout. All these chronic diseases, heart disease, strokes, atherosclerosis, liver disease, type 2 diabetes, gout and hypertension. So, we've identified the problem. We've identified the issue to society. And sugar, and fructose specifically, is implicated in this. So, should our government be doing something to address this? And should governments around the world be doing something to address this? I would assert that this is a public health epidemic, and it's not individual responsibility that's going to change this when it's a public health issue. Why? Well, fructose is a poison when we chronically consume it, and it pervades our diet. It's ubiquitous. It's all over the place. We can't escape it. Poison, ubiquitous. Number 3, we abuse it. We can't stop consuming it. There is an implication that when fructose is chronically consumed and there is insulin issues, then the signal hormone, leptin, which sends to our brains to tell us we are full, is switched off. So we have abuse issues. And then lastly, we have, as identified, the negative externality of society, the huge financial burden to our communities and global communities. So how could the Isle of Man government address it? This is what companies would use to sell a project, so we could reverse engineer that. Product placement. Should we sell these products in our schools and at our hospitals? Would we sell beer in the school? Well, beer has an acute effect on the brain when it's metabolized, but fructose doesn't exhibit that. However, look at beer, liver disease, insulin resistance, type 2 diabetes, heart disease, atherosclerosis, all these chronic conditions that are also exhibited by fructose. Would we sell beer to our children? This is somewhere where the Isle of Man government could step in. Product. This is somewhere, an area where it's going to have less influence because these products are shipped to the Isle of Man. We don't have the remit to regulate them in their production. However, in promotion, we may have an impact. We couldn't address things like marketing over the internet or marketing on TV. However, we could look at bundling strategies, buy one, get one free strategies that companies use to sell their products and increase our consumption of these products causing negative issues. This is something that can be addressed. And lastly, price. Identifying, is it something the Isle of Man could do? Should they do? And will it solve the problem, or will the system mitigating this great issue? So, number 1, why sugar-sweetened beverages? Sugar-sweetened beverages are implicated as one of the greatest concerns. Why? Firstly, you consume the product without fibre, so it hits the liver straight away, and that's when the problems arise, the insulin resistance, the fat making, de novo lipogenesis. Secondly, you wouldn't go to a shop, buy 5 oranges, sit down, and then eat through them. You'd probably get through 3 oranges. The fibre would stop you, your satiety signal would tell you, I'm full, I don't want to eat anymore. But then, you go and squeeze 5 oranges into a glass of orange juice. It's maybe 50 ml. You would knock it back in 2 seconds. That is where the issue arises. That's when the fructose hits the liver really quickly. That's when these chronic conditions develop. It's not just about soda. It's all about all these sugar-sweetened beverages. They own the medium where we are feeding our disease. We're sick people. Lastly, these products are very cheap, but they have a huge social implication, a massive cost to our society. So, a tax introduced to right this would assist. So, to close, I think it's imperative that we act now, and this can be the greater good for our society, and we could hold up the mantle to society of the rest of the world who are also suffering these conditions. And I'd appeal to the audience today If you can assist me in this drive, please come to me, talk to me afterwards.